So I am really excited to introduce Amelia Fontella. So she's a communications professional with more than 15 years of experience supporting organizations and small businesses. In 2016, she co-founded Green Table Media, a marketing and communications consultancy that provides transparent, empowering support tailored to each client's needs. Grounded in social justice, her work spans public health, higher education, and nonprofit organizations, partnering with individuals and institutions committed to doing good. Amelia has collaborated with HCT for the past 7 years, and in addition to her communications work and consultancy, she regularly teaches creative writing in and around her home community of Madison, Wisconsin. Amelia, I will turn it over to you.
Hi, everybody. Thank you. It's so great to be here today. I hope you're having a great second day here at the summit. I feel like I had an introduction on my list, but that was such an amazing introduction. I don't really need to do much about myself, but just to say it again, my name is Amelia Fontella. I'm with Green Table Media, which is my company. And I'm proud to have been working with HCT and lots of different clients across the state of Wisconsin and beyond for the past 9 years. Um, Today, we're going to be talking about a particular project that was a partnership between Wisconsin DHS, HCT, and the Patch program. How many of you are familiar with the Patch program? Okay, great. We'll talk a little bit more about who they are, but they're a great organization here in Wisconsin, and I'm glad some of you are connected and aware of them. I'm curious just who's in the room today a little bit. I'm not going to make everyone, I would love to actually hear full introductions from everybody because I'm a teacher and I teach creative writing and I love to do that. But there's just too many and we don't have enough time for that. But who here is doing social for your organization? Okay, a couple people. Who is doing some youth outreach in some way through your organization? More hands. Okay. Who feels like if they were a little bit better equipped, that they could do some social outreach to youth via social media? Okay, a few more people. Well, my goal today, like I said, I'm going to talk you through a specific project which resulted in some social media assets. So some images that you can use. You can take them, use them, put your branding on them. And that's great. We'll talk about that process, how those were created. You will have access to those. But really, my goal for today and for you all beyond that is that you leave in a little bit more empowered in terms of connecting with youth in the social media space. Whatever that means for you and your organization. I know a lot of you are running very tight ships. There's not extra money, there's not extra time. And so we're going to hopefully find ways to think about this as really scalable. You don't need a dedicated communications person in your organization. All right, let's see. Let's just move to our next slide. Okay, that worked great. So this is just a quick overview of sort of how our time together will unfold. If questions come up that feel really tied to what we're talking about at that moment, feel free to raise your hand. I was telling Adele, I'm used to teaching, and so like that's not going to interrupt me or put me off course. Like just if there's something, and if it's kind of a more general question, then I'd just ask, save it for the end. But if it's kind of like, wait, how did you do that? What did you mean? Raise your hand. This is a small enough group that we can accommodate that. So before we actually dive into the content, I was telling Adele, I live in Madison. I grew up here in Appleton, and I actually went to prom here at the Paper Valley. Back then, I think it was just the Paper Valley Inn or Paper Valley Hotel. But it got me thinking about being a teenager again, right? And so for a moment, I want you to kind of take on that headspace of your younger self. We were all teenagers once. I want you to think about the messages you heard or received or were given related to sexual health or even just health in general. Just think about that. I'm just going to let you think about that for a second. You don't need to share it. You don't need to write it down. Just think about that. What kind of messages, if any, did you get as a young person about your own health, your own sexual health? So I know I got some messages that weren't very helpful. So think about those for just a second. Now I want you to think, what kind of messages did you need to hear? What kind of messaging did you want to hear as a young person? Again, you don't have to answer out loud. I just want you to think about this. What kind of messaging did you need, did you want to hear? What kind of messaging would have made you feel empowered, less scared, in control, safe, knowledgeable? So this project was a really unique opportunity to get youth input on some messaging that's going back out to the youth. So it was a chance to empower youth and elevate community voice of this certain population of young people. So today we're going to talk about the story of this particular project, the process that we went through to create the messaging. The reason we're talking process is because this is something you can do, right? We did this on, like, I am a graphic designer, I'm a communications professional. The cool thing is you don't have to be a graphic designer, you don't have to be a communications professional, right, to do this. So this is something, everything we're looking at today in some way, on some scale, you can do. You can implement in your own sphere. We'll take a look at those final products. I will talk through some of the logistics of how to access them and use them. So if you see the images today and you're like, those are a good fit for my organization, these are images that you are free to take and use. You can put your branding on them or not, okay, whatever is right for your org. And then we'll talk about just some things I learned, some takeaways from this project that I think are really relevant. I do a lot of communications work, often to adults. So this for me is a population that I had room to grow and learn as I worked on this project. So I'll share some of that with you. All right. Okay, so the story, the background on this is this project. I made the images, but I feel like in so many ways I can take very little credit for this. The graphics and the messaging you'll see today are the result of a collaboration between DHS, who was working partnered with HCET, and who brought in Patch, right? And Patch stands for, let's see if I can remember what it stands for, Partners and Teens Communicating for Health. Oh, yeah. Providers. Thank you. Providers and teens. Yes, thank you. So for more than 15 years, Patch, this organization, has been running the teen educator and teen consultant programs. So these are programs that partner with clinics, health organizations, all sorts of people. I'm not from Patch, so I'm definitely not giving them all the amazing stuff they do, but they partner with organizations really to be a resource in terms of how to engage teenagers meaningfully. So they help facilitate these partnerships between organizations and teenagers to get that feedback, to get the information how to serve that population. So their goal is really to strengthen youth-informed decision-making in their communities. So Patch was part of this. So this is cool. I mean, lots of people were working. I was just the person that kind of got to like put all the pieces together, right? So that was really fun. Our goal was to create a tool for use by health departments and clinics across the state of Wisconsin to engage with young people on social media. So this is a social media tool. The overall message is really about the importance of taking care of yourself. Your health is important. So that's kind of the big overarching message, but we had 5 specific messages in 5 areas. So caring for your health, healthcare independence, expedited partner therapy, healthcare rights, and DoxyPEP. So these were the areas that I sort of inherited. These were the areas. And so that's kind of what I started with. All right. So talking through this process, like, what did we do? This was the project. This was what I was tasked with to help create these messaging informed by youth for use across the state. All right, so the original kind of messaging and the themes were developed by DHS and HCT. I got the chance to transform them initially into images for social media, so graphics for social media, because as youth scroll through social media, what are they seeing? They're not necessarily reading that little block of text below an image or on an image. They're really looking at the image itself. So I started by creating a batch of imagery that I brought then to like essentially a focus group of youth through the patch program. So this was really cool for me because it's so rare that I get to connect with young people and get their direct feedback on my work. So I met with Patch for 2 different sessions. So I brought them some initial designs and got some feedback. Then I made changes according to their feedback and brought that back to the group. In that second session, I got a little more feedback that then led to some additional refinement in the images. So these images that you're going to see today and that you might choose to use are really informed, shaped, and in some cases kind of visioned by young people. So they're not just, I'm not a teenager. They took kind of me as a starting place and we worked together to shape these and make these something that youth felt like they would actually engage with on social media. And again, I've said it before, I have the word scalable a lot because I just want to remind you that I think everything we're looking at today is something that you could do in your own way. I met with a group of, 12 teenagers through Patch. But if you have 3 teenagers, you can pull together. If you have a teenage child at home who's willing to give you a little feedback or their friends, like you can get creative of how you get this. You don't need to have a focus group, right? You just need to connect with teenagers. So you all know there are teenagers in everybody's lives somewhere. It might be your babysitter. It might be someone you work with. There are teenagers out there. So use them as resources and, pay them, reward them, buy them coffee, give them a Starbucks gift card, right? Like also their time is valuable, just like ours is. So don't take that for granted. The patch educators, that's a paid role. And I think that's important too, to know that like the youth were compensated and that if you solicit youth feedback, find a way to compensate them. Again, it can be small, could be meeting at Starbucks and buying everyone a drink, right? Whatever, or at your local coffee shop. All right. All right. Now we take a look at these. I've been talking a little bit about these things. So let's just take a look at the first one. So the message that I started working with that was essentially came from DHS, right, was your health matters. Learning about STIs, getting tested, and using protection are all ways to care for your health. This is our final product here. And there were some things along the way that surprised me as I was working with the youth. One was that they were surprisingly pretty big fans of a little bit more conventional imagery, but not cheesy imagery, right? Like this photo, it's not just some fake looking doctor with a smile on their face, right? We're not even seeing faces because the youth said this too, this allowed them to see themselves in the role of the young person. It's really clear in this image, there's a young person or person talking with a medical provider. And they liked that perspective a lot. They said, it feels like me in that picture. They also really liked the use of second person, right? So the use of you have a right, not teens have a right, young people have a right, you have a right. We've already clarified our audience at the top by saying we're not just talking about healthcare access, we're talking about healthcare access for teens. So we've clarified the audience, right? Everyone, if you share this on your social, guess what? Most of the people who see it will not be teenagers. But like you, they might know teenagers. Some teenagers will see this. That's our big goal. But being realistic, it's a broad audience that will see these. So we're clarifying, we're providing information to everyone, right? This is about healthcare access for teens. Teens have a right to healthcare, but we're speaking directly to our teenage audience with the use of the word you. And the students really, they really appreciated that. They really appreciated being spoken to directly and professionally. Um, the word right, you have a right to access healthcare. That wasn't in my original version. I forget what I said, but they really emphatically wanted that word right. They felt very empowered by having that understanding that they have certain rights to be able to access healthcare in this case. Um, let's see. Yeah, so this is just one of them. Again, this image, this was created in Canva. So we're going to talk a little bit about Canva because that is a free and low cost tool. Many of you who's already using Canva, lots of people. So, I mean, Canva is a great tool. I do use the paid version. So the images, like the stuff I used might not be available in the free version. It doesn't matter. You can use these images because I created them and I'm making them available to you. But even in the free images, like you can dig and find what feels right. You'll see that in none of my pictures today do you see like really clear faces, right? That's really intentional. One, you want to be careful, like just from the like logistical, like legal perspective, when you're using stock images, there are some laws out there. I don't know if they would ever be enforced in these situations, but there are laws about if you would take a picture of a smiling teenager and imply that they might have an STI, there's some usage issues with that. So I tend to avoid stock images with faces. Also, I find the faces sometimes, unless you get really great stock photos, they do feel cheesy. They do feel like a stock photo. And by not showing the faces, sometimes it feels a little bit more authentic, more like almost what, like, again, someone could see themselves in that situation. All right, let's look at another one here. All right, so this was our expedited partner therapy. This was a really interesting one because this was an example where I brought a really cute image to the youth. I had a pair of two like mismatched socks that looked enough like a pair, but they were clearly a little bit different. And I had that line STI treatment for two with these socks. I just thought it was cute. It might catch someone's eye as they're scrolling. Some of the students liked the socks, but mostly they were like, they preferred, I brought them two images actually. I brought them this one and the socks, and they really overwhelmingly, again, preferred the more conventional image, right? Of two people, perhaps they're a couple. It also could be any two close people, right? It could be friends. They really liked the warmth. They kept coming back to the emotions of these images that they really liked seeing, like feeling the warmth, feeling the connection. That was something that came up in almost every image that we looked at. So here our message: expedited partner therapy allows partners to get treatment without an extra visit. Talk to your provider to learn more. And so here the messaging is pretty straightforward because you're also working in a very tight space. Those of you that do social probably already know that this is about the maximum you would ever want on an image. This is really a little bit too much, but we are trying to convey a pretty complex message about a really specific resource that's available. So in this case, it is a little bit longer, but I would say like this is the max that you ever want on an image that you're using in social. This is the max. This is more than is ideal. So yeah, this ended up being sort of a hybrid of the two versions that I showed them. And again, they liked the literal messaging. They liked more literal photographs. Now, this was one group of teenagers, right? I think there were about 12 in the session from all across the state of Wisconsin. So, this is still a limited representation. They did not reflect all teenagers everywhere. But certainly what they shared, it didn't really surprise me, and it definitely doesn't fall out of line with just general best practices in communications. So I guess they were very insightful and gave great feedback. So I trusted their feedback, I'll say. All right, let's take a look at another message. And I'll say too, as you look at these assets, you'll have access to all of them. Some of them might not be right for your clinic, your community, the organization that you work for. That's okay. You don't have to use all of these, right? You don't have to use any of these. These are just resources. So if you're saying, well, you know, we don't we don't offer expedited partner therapy at my clinic. I don't know if that if that's true or not, but then obviously don't use this. Don't use this one. So these aren't all like necessarily one size fits all. All right. Okay. This is and I like this one a lot. This is one of my favorites. This is kind of the most general one. This is on that theme of caring for your health. Your health matters. Learning about STIs, getting tested, and using protection are all ways to care for your health. And you'll see that message is pretty much reflected right down there. It's pretty straightforward. Your health matters. Here, the students loved this image. I looked at so many different images, and again, they liked this because it felt real. It felt like almost like something they would see scrolling in their phone, pictures of friends. Again, you're not seeing, you see some side profiles, but they're not, these look like they could be kind of kids anywhere, teenagers anywhere. It felt real. So I think that's something to think about as you're choosing images. Choose ones that feel real, avoid anything that might be cheesy, right? They liked these really, really real images. The patch advisors felt a really strong emotional pull with this image. That came up a lot. Emotions and how images made them feel. They liked how they used the words warm and comforting. And in this case, too, they chose this image over a less conventional image. So I'd presented them with two images. One was of like somebody drinking like a green smoothie, like kind of, again, me as a designer, communicator, trying to like be attention grabbing. They didn't like that. They wanted something more conventional that lined up directly with the message. So I think that's like images can be really powerful. I would say like as a graphic designer, I spend a ridiculous amount of time choosing my images. I spend more time probably looking through stock photos and choosing them than I do making the assets themselves. So expect that as you're looking for images to use in Canva or any resource anywhere, like that is going to take more time than you think. It's kind of fun, but it's also like give yourself that time. It is worth finding the right image than just choosing the first image that comes up and thinking that that's going to connect with your audience, because it might not. And and again, look for images that convey some kind of emotion, that make people feel a certain way, right? Because that's what they're going to latch onto. That's what they're going to remember from seeing that on social media. All right. All right. So this healthcare privacy, this one was the most challenging for me because it's in a lot of ways, it's the most abstract. Healthcare privacy is a very abstract thing, right? So I had presented the teens with a couple images, including one of a health clinic that had a sign out front that said parents not required. Again, cute, right? Like attention getting. This is me as a 40 something thinking like this is maybe what will connect with them. Oh, you don't need your parents. Um, they thought that was okay, right? But it didn't get their attention. So this one, and I think I also had one with like uh, um, a prescription pad, and it said I think it was this one. It had a message on there in kind of a script, which they did not like the script. So a lot of young people are not, it wasn't in cursive, but they're not comfortable reading cursive. They did not like fonts that looked like cursive. So avoid those. And that's just honestly, that's best practice in communications anyway, is to, really focus on making things extremely easy to read, especially when you think about the landscape of social media. These young people are spending a lot of time engaging with social media. They're moving very quickly through it. So if it is hard to read, unclear, they will just scroll right by. So they loved, like, one thing that they, like, the font, they wanted it big and bold and easy to read. Big, bold, easy to read. High contrast. So again, really best practices in all kinds of graphic design, but they were really in tune with that. Um, so this one, yeah, healthcare privacy. In many places, teens can get healthcare without a parent. So this is a little more tricky because it's not necessarily universal, right? It is kind of depending on location a little bit. Ask your provider about your healthcare rights. They can explain what stays private and when they might need to tell someone. Um, and so this we just tried to boil it down as much as we could. So healthcare privacy for teens. We're just like, don't be afraid to just say, here's what we're talking about, healthcare privacy for teens. Like, don't try to bury it, don't try to be cute. And then in many places, you can get healthcare without a parent and your info can stay private. This image came about directly directly from a suggestion from one of the patch consultants. They had suggested a top secret folder. So which I loved that idea, but I'm also looking at like kind of the broader, all of the audiences that might engage with it, all of the people that might use it, all of the different connotations with top secret. So I took that idea of top secret folder and found something that just felt a little bit more appropriate for this line of messaging. And it was just a folder, confidential, right? Just something really gets to the heart of it. Like some of your health information, there's some confidentiality that is available to you. So this also started off, like I said, with this. I thought like that again, you come to this with assumptions. I thought that the youth would be most concerned about getting some one-on-one time with their provider and not needing their parents there. But for them, they really said that's not as much of a concern. It's just generally keeping our information private. So whether that's a conversation with a provider one-on-one, knowing that that information will stay with that provider. So I shifted this a little bit from the idea of no parents to like, you are entitled to some healthcare privacy, but ask, right? You need to ask to understand, because certainly there are some things providers will not keep private. Yeah, so this is the only one of my assets here that doesn't have a person in it. Again, this is really abstract. And when you're trying to represent really abstract things, you can put people. We could have used like a doctor and a student, a doctor and a young person again. But trying to think a little bit outside the box, what could represent that. So this is the only one without people. But they did really like to see people in in these ads. They also, one thing that came up, which is why I went with the confidential folder and not the top secret folder, is that some general feedback that I kept getting is they like messaging that feels professional. So again, like I've said it, I've tried some stuff that's sort of cute. They really want things that they want to be taken seriously, right? Just like all of us do. But they used that word with me a couple times. They are like, "Ooh, I really like that. It feels very professional." They use that word with me a lot. So again, I think confidential is more in alignment with that idea of a professional message than top secret. Top secret veers toward that cutesy a little bit. But it was such a great idea. So like that idea got me to this, which they ended up really, really liking. Just gonna have a sip of my water. It's down here. And then our last one, and I just want to remind you, or just as a sidebar, why am I telling you this story? How she created these? It's because you can create these, right? What I learned is something you can take away. You can create your own messaging. So I think it's helpful to understand, like, this is how these came together. You can do that in some way in your own work. Okay, this is the DoxyPep one. This one's tricky. It was tricky a little bit. I'm not a public health professional, but I know that DoxyPep has a limited audience. So this one was a little tricky, but the youth really seemed to like where we ended up. They really appreciated, they loved that the pill was highlighted. that in this case, it's a medication that you take. It really made it feel a lot less scary to them. Um, Again, a really literal image of someone taking a medication. Um, and I think, a lot of times youth can be scared of what happens on the other side of something. So if they need to get in touch with a provider or a clinic, I think it's scary to them what happens next. That's unknown to a lot of students. It's like for most of you, that's your work and you see it all the time. But for them, it might be their first time engaging with a clinic or with a healthcare provider, especially if they're doing it on their own. So I think this image in this very particular message, a very specific message, um, is something that just demystified like healthcare options. So again, whether or not this image works for your organization, I would consider that of showing them what happens on the other side of the door when they walk into your clinic, when they engage with your organization. Let's see. Yeah, and so this is just fairly straightforward, right, about this doxypep one type of STI prevention, right? Um, or reduction thing. So all of these are available as Canva templates. And next we'll talk through just how to access them, a little bit about Canva. Some of you are pro users already. But before we do that, do you have any questions at this point about the messaging, about the process of engaging with the youth? Great. Sure. Great. All right. Ooh, great questions. Okay. Oh, I love these. Okay, so hopefully I see there's 4 so far. What surprised you most about working with teens? Oh, that's a great question. First of all, I was surprised at how much I totally loved it. Now, I think Patch really brings some very engaged um, youth that are out there trying to make the world a better place. So it was a very special population, but I was surprised at how absolutely observant, articulate, and really just how good their advice was. How they were able to present feedback in a way that talk about professional. I mean, the way they presented their feedback, I take in a lot of feedback in my work as someone that creates things for other people, but they really had a great sense of what was working and what wasn't working in in the assets they created, and they were able to present that in a way that, and I told them, I was like, look, I'm not going to be offended or be bothered, but they really were able to present that in a way that talked about the work and not the creator. So I guess it just was so delightful to work with young people. I would do it again in a heartbeat. So again, if you have a way in your own roles to pull in even a small group, 2 or 3 people, because even though those 2 or 3 people might say, well, like I had somebody tell me, well, I'm on Instagram a lot. And I was like, yeah, maybe young people don't use Facebook very much. She's like, no, but my friends use Facebook. So they can also speak on behalf of their social group. Yeah. Thank you, Adele. All right, next question. What do you think were the key differences in how we communicate with youth and adults? That is a great question. I think there are fewer differences than I expected, would be my first response. I think though I think we all have short attention spans, but I think youth are, not that they have short attention spans. That sounds like, I don't really mean it that way, but I think they're going through, when they're engaging with social media, they're going through a lot more content in a shorter amount of time than I am, right? So I am more likely to maybe linger on something. They are absolutely not. And they told me that, right? Like if it's not engaging me, I'm going to scroll by. And all of these messages are designed to be consumed very quickly, right? All of these messages can have and will have a longer portion where you'll give them next steps. You'll give a call to action. You'll connect them to your clinic, your organization, other resources. But what are they going to see as they scroll by, right? That might linger with them. So I think that's the biggest difference. I think youth and adults need a lot of the same things. We all want communication that is accessible to us, that is engaging, that is not wasting our time. But again, I think youth are really more in tune with like, it really needs to get the messaging across effectively. So again, like almost in tune to the best communication practices in a way that a lot of adults we're not always as aware. Yes, were there conversations about what platforms work best to advertise and reach young people? Yes, I came to the group with some questions, and that was one of the first questions I asked. Where are you? So the number one place, does anyone want to guess? TikTok. This is what this group of students said. So Snapchat is another, I looked at the Pew Research. Snapchat is right up there with TikTok. And my students didn't mention YouTube, but this campaign really isn't designed for YouTube. So that's kind of, we're setting that aside. They're spending a lot of time on YouTube. That number's a little higher in the male population. But TikTok, Snapchat, Instagram, right? And Instagram's really important for us because most of your organizations probably have an Instagram account. Most of your organizations probably do not have a TikTok account. Is that right? Because I mean, the state of Wisconsin is basically like, I don't know how it works at the county or other levels, but I know at the state level, like you can't use TikTok, right? So knowing that information, we really focused on Instagram because how many of you have a Snapchat account for your organization? How many of you have an Instagram account? Yeah. So that's why I chose Instagram. These images will work great on Facebook too. And I would encourage you to share them out there as well, or any platform that you're on. But yeah, they said like TikTok, and the students I talked to said TikTok and Instagram is where they are. So again, for most of us, that means Instagram is a really great way to reach out to these students. How can people who make socials check for readability? I'm guessing I'm not exactly sure what that is asking, but I'm guessing they mean like, how is it going to look in the platform as somebody is scrolling? And I would say, and again, I'm not sure if I'm addressing that, how that person's asking, but I would test it, try it. Like if you have your own social account, post it, try to post it, or set up a dummy account so you can have a place to play around, like a sandbox, so you can see how something's going to look. But also if you post something and it doesn't line up right or look right, delete it, try again, right? This isn't, it's okay. Like it's okay to try things that don't work in the social media landscape. All right, I think those are I'm going to give this back to you. Yeah. All right. Yes.
Public health agency only has Facebook.
Yeah.
You said this does work there.
Yes.
Is there anything you would do to make that adjustment?
Facebook in some ways it's an easier landscape to share like resources and links. So I would say like share them on Facebook. I don't think you'll have use them how you'd share anything else out on Facebook that's working for you. But I don't think in my opinion, there's not a tremendous difference or anything you really need to do differently. But I do think Facebook makes it a little bit easier to add in links that are clickable. As an Instagram post, you can't put a link in the post, but you can put links in reels and story. So Facebook is just such a nice, easy landscape. And teenagers are on Facebook, just not in the same numbers that there are other places. So by posting on Facebook, don't think you're not going to engage with teenagers. And again, I also think about the impact to people who support teenagers. Seeing these messages, I don't have teenagers. I have a 10-year-old son who I think will be a teenager before I know it. And I think about messaging around teenagers. And for me, it's something to think ahead about some of these ideas and ways to support him in, being responsible for his own health as he grows older. So I might see messaging on Facebook that impacts me and then impacts my child. So,
You kind of got on it, but someone just asked.
I'm sorry. No, she asked essentially like, if you only have Facebook, how will these images and these messages work? And is there anything you need to do differently? So I'm sorry. Just got so excited about the question. But yeah, no, I mean, there really isn't. Use them how you feel comfortable. using them. But I think you're still going to get some teenage engagement on Facebook, right? Just not as much, but they're still there. The teenagers I met with assured me my friends are using Facebook. Yes.
And not everybody knows they're linked. You can link it. You post on Facebook, it can automatically go onto Instagram.
Yes.
10 out of 10, unless it's too long or something like that, but with this field and what you're doing with those quick images.
Yes. Yeah, I will. Yes. So someone suggested that, you can link Facebook and Instagram and they are kind of linked. It almost does it. I think it happens by default now, that things that are posted on Facebook are shared out on Instagram. So by sharing on Facebook, you might get some reach in that way. Thank you for that. Yeah. Yes. Yeah. So, I mean, in every case where you're posting, really, we're thinking today, we're talking mostly about Instagram and Facebook. In both cases, you have the opportunity to add text, to add language. If it's a post, you have like the body of the post where you're going to put more details, right? So the expectation is you can use some of this language, you have some basic messaging, but it is essential that you add a call to action. So saying like, call your provider, call us, chat us on Messenger, however you want people to get a hold of you, that you're giving them that resource, you're giving them that next step. It's not just like, here's some information with like nothing to stand behind it. So that messaging that you are going to write is very important as well, because for the person who this resonates with them, the person that does stop, like, oh, this message is for me, they will look. They'll see this first, but then they're going to look like, what's the rest of the message? And that's where it's really important to like give them their next step, right? Call this number, stop in, visit our website, whatever it is whatever action you want them to take. And that will be different for all of you. Great questions. All right, let's just take a look at, so I said these are all available as Canva templates. And half of them, so there are 5 images, there are actually 10 when you access the template. Half of them have space for a logo. Now, for some of you, if you have a really long logo, it's going to be hard, and maybe there's a portion like a shield or an image that you can use that's recognizable for your institution. But as I looked, I found a lot of public health clinics and organizations across the state do have logos that would fit, or you have a logo option that would fit. So I realized there will be some people that you're like, my logo is just going to be like teeny tiny, right? We're working with such a small landscape. So if that's you, I'd say don't put your logo on it. Maybe there are other ways to get around that you can see me after if you need those tips. But these, when you go into the Canva template, these red, where it says red, your logo here, you can select that and just delete it. You can't change anything else on the templates, so you can't screw anything up. But you can that's the one thing you can click on and delete. So yes, this is available as a Canva template. You can use them with a free Canva account. So they're actually uploaded. They're not images that you can edit. So you cannot edit the language here unless you want to drop in like, something to cover it up or crop the image. These are all, because I used a paid account, these are my images that I created. I'm sharing them with you, but they're shared as completed image. You can't share like the paid designs like that, because then I'd be giving people paid assets. So anyway, this is one of your options. But again, I don't know that you need to brand it. I don't know that that's up to you, and your audience, and your institution's best practices and the things you're expected to follow. But I think like youth, I don't know that they'll necessarily need to see a logo. The credibility will be there when they see the organization who posted it. But that's a very going to be like an institution to institution decision. So here's how to access them. So if you want to see them right now, you can grab that QR code if you want. I'll give you a screen at the end that you can for sure just take a picture of. This is also in my presentation. I think you all have access to these slides that were sent to you in your confirmation. Yeah. And you have the short link. So even though like you might not have something clickable, like you have it printed out, you can just type that in. You can also, if once you scan it on your phone, if you have Canva on your phone, then that will just be there in your Canva when you sit down on your laptop to work. Because I don't like to design Canva. I don't design on my phone. Great. Yes. So you will have it. So once you scan that, you will get something that looks like the second screen, and you'll see and we'll look at what those pages are, like what information is there. But then you will need to log in or create a Canva account. So most of you are already using Canva, so you'll just have to log into your account. If you don't, just set up a free Canva account. Okay. So the first two, when you log in, when you actually see the template, you'll see these two pages first before the images. So here you have those messages. So this is like a great starting place for that additional content that you might write in the body of a message, right? So in social, you're going to be posting your image, but then you have a chance to write something, especially on Facebook and as an Instagram post. But I wouldn't stop there. I'd also feel free to change these. Keep them short, to the point, and clear. But if you have a way that makes sense for what you're sharing, what you want to share, who your audience is, change them. Okay, these are starting places. So yeah, tip number one, that's using them as starting places. Share them on any platform. These will work on any platform. They're square, which is really nice for an Instagram post, but it will look beautiful on Facebook too. So I don't think you'll encounter any problems with that format and any platform. Let's see. Yeah, the teen said Instagram. We talked about that. Instagram and Facebook have, they have like the most kind of, not easy, but the frontline way to use those platforms is to do a post, right? But remember, they also have stories and reels. If you're like, what's a reel? I don't know. Just check it out. Try it. We're not going to get into how to post a reel, but you can Google that. How do I post a reel? You don't need to have video. You can use images. So maybe you're choosing one of these images, and then maybe you're choosing an image of, your clinic, your place. Maybe you're choosing some other stock images. You can build these little reels without having video footage. So don't get freaked out by trying something new. These teens they are everywhere. And when I ask them, like, what part of the apps are you in? They're like, they kind of bounce around. So they're seeing posts, but a lot of times they're like scrolling through reels and stories. So don't be afraid to put the same message in multiple places. Don't be afraid to share it on multiple social media platforms. Don't be afraid to share it again a week later, right? Because you think about it, when you put it out there, it's like it's throwing, a bottle with a letter into the ocean. Like, somebody will find it, but you're going to miss a lot of people. But if you throw another bottle, someone else will find it. So I asked them, like, does it bother you if you see the same messaging or same images in two places? They all said no. They're used to that. So don't be afraid to like kind of be a little more aggressive, like get it out there a few times. Don't just like drop it once and then walk away. Like try it in different places. We talked about calls to action. So this is all in there because this is really important. So anyone accessing these templates, these are here for you. The students also recommended pursuing collaborations. And the example they gave me is somebody said, at my high school, we have a health-focused student group. Reach out. She said, like, we have clinics or whoever reach out to us to ask us to share their messaging on our Instagram. So find those places that you can just ask, hey, can you share mine? We're going to share some messaging directed at teens. I'm going to tag you or I'm going to alert you to it. Can you share it out on your platforms as well? Because if you just put it on your organization's social media, that's a pretty limited audience. But if you can get someone else to post it, or share it, even if you share it as a person who works for that organization, if you see that post from your organization, like it, comment on it, and share it, because you want to basically, I call it feeding the algorithm, right? You want to encourage that to get shared more broadly. So engage with posts. If teenagers engage with posts, please engage back, right? If somebody's engaging with you and you get the sense, sometimes you won't know, but you get the sense they're a young person, make sure you're engaging with them. Don't just ignore those comments. or reactions. You know, and yeah, again, ask people to share. Another good way to amplify the message here is just to tag the patch program. You know, that when you're depending on the platform, usually if you do the @ sign and then start typing the patch pro, it'll come up, but you might have to be following them. So make sure you've liked or followed their account before you try to tag them. But I asked Patch if this was okay. They said they're happy to do that. But, you know, you could give them a little shout out, like image created by, you know, youth as part of the patch program. Because then when the patch program, when their social media manager sees it, guess what they're going to do? They're going to share out your post, right? So that's what you want. You want to just kind of naturally let it get out there, but tagging Patch is one way to do that. All right, so a couple things just to keep in mind, logistical things when using the templates. When you open the template, it creates a new file for you. So you don't have to worry like, oh no, I deleted something. Like it's your copy. You can't, the only person that can change the template itself is me. So you'll see even on this screenshot, you maybe can't see it, it's really little. It says copy of youth social media graphics template. So you can rename it, it's yours now, right? And so again, you'll see 2 versions in there for every one of the 5 areas we talked about. You can delete your logo here and replace it with your own logo. And if you don't know how to do that, there's so many resources like Canva one-on-one kind of things, but it's basically uploading it and dragging it over, right? A hot tip about logos is if your logo has a white background, Canva has a great tool called Background Remover. When appropriate, remove that background because nothing looks, you know, like you see a logo here, it doesn't look the same if it's in a white box, right? It doesn't look professional. It looks like you slapped that on there. So don't do that. Use the background remover tool in Canva. And then to download, I just like to remind people because it's not totally intuitive that you're going to click share. And then from there, you can choose download and then you choose your file. A JPEG or PNG will work for most uses. So I learned a lot through this process. Some of my main takeaways is youth are they're receptive to this messaging. They're receptive to engaging with you. Your task is to cut through the clutter. They see a lot on social. They're bombarded with these messages. So do what you can to make it really easy. Think about ease of access. Bold messages, bold look, but keep it professional. So learn from me. Cutesy things like that might seem fun. It might work for adults. The youth really just wanted like, hey, get to the point. Show me a picture that lines up with that message and tell me what you need to know. They don't have a lot of time. Minimal content, clear call to action. The call to action in this case isn't in the image. This is up to you because the call to action will depend on what you want them to do, right? Do you want them to look at some resources? Do you want them to call you? Do you want them to come in? Do you want them to share the image? Whatever your call to action, make sure you say what you want them to do, right? That's really important in any messaging, not just for youth. Youth want to take action. So make sure you tell them clearly how to do that. Share resources. That's another thing too. So if it's the DoxyPEP one, share, you know, if that's something you offer, great. Otherwise, link to reputable information about DoxyPEP. Let's see, tips. So you're hearing a lot of things. I'm a teacher, and so I know we're going to talk a lot about call to action because that's really important. Please don't forget that part of it. Consider collaboration, share in a variety of ways, involve youth in messaging. It's okay to share again. Try something new. Be willing to make a mistake, right? If you haven't done a reel, if you haven't done a story, try it. Just try it. If it doesn't work, you can delete it. Really, you're going to do very little damage. Okay, try it. We'll go back to that question. Well, I'm just going to ask that question now really quickly. Have any of you out there like this? I'm sharing my one experience. Is there anything that like has just worked for you that you would like to share with the group? Okay, thanks. I got it.
Okay, so I have something that has worked for us, but also is a question. Is video. I guess that was my question was we get more engagement typically with videos we do. What was youth feedback on a image versus a video? And I also want to ask about your color palette. We get locked into our city's color palette, and I think it was really eye-catching. Did the youth have any input on that?
Thank you so much for those. So this particular project, we didn't have the budget or the scope that wasn't part of this project, but video trumps everything. So if you have the capacity to do videos, even if they can be shot on a phone, they can be, feel really even unpolished as long as you're okay with the content that's going out. Sometimes that's even better because it feels so real. So if you have the capacity to do any video, absolutely do that. Put it everywhere. I mean, that is absolutely the very best thing you can do. The youth did say in terms of video, they always want captions because again, they might be scrolling through. Of course, that's like best practice for accessibility, but for them, they might be looking at a phone in a place where they're not listening to the sound. So your message can still get across through captions. And then, the color palette. Yeah, so they did offer input into the color palette and I made some tweaks. So I came to them with pretty bright colors because one, it allows me to do that contrast that's eye-catching. I also just think people in general are drawn to colorful things, even if that's not how you choose to decorate your home. It's what catches your attention, right? We know that's true. Bright green is much more eye-catching than like a dull gray. But they did help refine that. I had initially had some slight gradient, so slight, very slight, where it went from bright to a little bit lighter. They did not like that. They told me, they noticed it. I was shocked. They said, I don't like the gradient. So I got rid of all the gradient. I loved the way the gradient looked, but they really were very sure that was not for them. So they did like the bright colors. And the times I got feedback on colors had to do with contrast. They wanted the most contrast possible. So like in some cases, I did flip some colors. I came with a really similar color palette, but I did make little tweaks to increase the contrast for them. So that was a very big issue. They did not like the gradient and they liked the contrast. They also didn't like things overlapping. This might have been just that group, but in design work, a lot of times things might overlap. They didn't like that. They really wanted things kind of very clean. Yeah, it was really interesting. I'm going to put up my next slide because it does have a great screen where you can, if you want to take a photo or grab it just nice and big there. I think we're about at time, aren't we? 1 minute. Do we have any on the computer questions? Anybody have any questions or anything else they want to share? Yeah.
Oh, I'll bring you the mic.
Yeah,
if that's
thank
okay.
you.
Yeah.
It's a quick question.
I know you said about tagging them just as a way to give credit, but is there anything like legally we have to do to give credit to the source for these or no? No. Okay.
Yeah, I'll take it. No, you do not have to give it credit to anybody for these. I don't think DHS probably even wants credit. Like this is something for you all. Like don't put anybody else's branding on it. You can give a shout out to Patch. But otherwise it's yours to share out. Yeah, thank you. That is a really important question. Nothing legally that you have to share. Yeah. Well, and these are, I mean, basically I've paid, I mean, the project paid for these images. So we have the rights to share them out. So like the photographs they're licensed for that use and they were purchased appropriately. So yeah, thank you. Oh, great. Well, thank you so much. Thanks for your questions and feedback and just being here today.